Hello everybody, I'm back. Dr. K.K. Agarwal, President Heart Care Foundation of India and Confederation of Medical Association of Asia and Oceania. You are watching Med Talks with Dr. K.K. Agarwal, and that's 47th episode, COVID edition. Basic purpose: to relieve the fear amongst the mind of the people, give them better immunity, and talking about a non-inflammatory lifestyle. Let's have the headlines of the day. India is the only country in worst hit 20 cases where peak is yet to come. We have seen peak in many states, but not in India as a whole. The Nagpur bench of Bombay High Court constituted a 5-member committee to examine all aspects related to bed shortage and suggest remedies to differentiate patients between COVID and non-COVID. The scientists at Institute of Genomics and Integrative Biology have developed a rapid and sensitive test for coronavirus detection. Sooner or later, it is going to become like a pregnancy test. Good news for the cricket lovers. The IPL Chennai Super King team underwent a COVID test on Thursday morning and all have tested negative. They started a new concept, 3 tests. Normally, we say 2 tests negative, you are negative. This is 3 consecutive testing, you have to be negative. The Bengaluru Mahanagar Palika, that means Mahanagar Palika, has said no pasting of posters on COVID patients' house. This says it discriminates the people. Let's go to the topic of the day. We know that COVID-19 is an inflammatory illness. Ayurveda calls them as exaggeration of the Agni in the body. In modern medicine, we say this is inflammation. And when it comes to inflammation, we talk about high sensitivity C-reactive protein. And we say, already we have been talking about a state of low-grade inflammation, that is diabetes, metabolic syndrome, hypertension, high cholesterolemia, and coronary artery disease. All those patients where we have been discussing about low-grade inflammation, today we know that this virus causes high-grade inflammation in those who have low-grade inflammation, therefore they have comorbid conditions. Today we are going to talk about the same inflammation and how to build up immunity through diet, supplements, when we talk about the inflammation. Let me introduce my guest today. My guest is Professor Hemraj B. Chandelia. He is the currently Director, Diabetic Endocrine Nutrition Management and Research Center and Director, Endocrinology, Diabetes and Metabolism, Jaslok Hospital, Mumbai. He has been an honorary professor of medicine and diabetes for 30 years at Grant Medical College, Mumbai, and trained both under and postgraduate students. A passionate teacher, orator, and profile writer, prolific writer, he has brought Indian Diabetes Journal, books, and magazines to international levels. He is also an active researcher. Welcome to our show, sir. Dr. Hemraj ji, how are you?
And, Hi, thank you.
I and he have been interacting for some time before we started this program, and we have been talking about the word inflammation. So, Dr. Hemraj, we also saw that diabetes also is a low-grade inflammatory disease because the concept of high sensitivity CRP is there for over a decade. And we say if your CRP is between 1 to 3, you are suffering from a low-grade inflammation. And this low-grade inflammation is different from inflammation, which presents with redness, warmth, swelling, and pain. So this is subclinical inflammation. So if your C-reactive protein high sensitivity is but between 1 and 3, we say your body is burning with a low-grade inflammation. And if you have a high LDL, it gets cut stick, and it will cause all types of thrombotic disorders, which is what we have been calling about diabetes as a metabolic disorder, and therefore came as a cardiometabolic division where we talk about cardiology and diabetes under one banner because all of them share a low-grade inflammation. Can you elaborate on that?
Yes, I think the diabetic and of course metabolic syndrome and the obese person and even hypertensive, they all have this inflammation. The inflammation mainly is of the blood vessels, and in the endothelium, it has been adequately shown that the inflammatory responses are there, the adhesion molecules are there, the form elements in the blood they change, the platelets change. So many things happen because of the low grade inflammation. And of course, on the background of this low grade inflammation, we will be always now, currently, we are looking at this very high grade, very acute inflammation produced by COVID-19 infection. So I think that's why the susceptibility of these individuals for they succumb to a greater degree to the consequences of COVID infection than do the non-diabetics or non-hypertensive. So comorbidities we keep talking about is the background of this low-grade inflammation on which this very high-grade inflammation is planted, and that really causes serious consequences.
So whether this is fatty liver leading to non-alcoholic steatohepatitis, whether this is asthma, chronic obstructive airway disease, all have one thing in common, and that's borderline or low-grade inflammation presenting with a CRP of 1 to 3 and also high IL-6 levels. So in cardiology practice also, we have been talking about if you have high baseline IL-6 levels, you are more prone to get LDH. You are more prone to have LDH becoming more sticky, depositing in the form of a chronic fibrosis. But here, if a low-grade inflammation over a period of time causes fibrosis and something like a coronary blockages, acute inflammation causes thrombosis, which is acute. And that's what the difference between a low-grade inflammation and a high-grade inflammation. In high-grade inflammation, you get thrombosis, which is the genesis of COVID-19. Dr. Himraj.
Yeah, I think high-grade infection that is mounted by the COVID infection. It is really very, very acute. It's hyperacute, and it is mainly inflammation produced by immune mechanism. So it is an immune inflammation, and therefore the approaches we take are to really regulate the immunity, or we call it modulation, because we don't want to say certain factors increase immunity, certain decrease. It really the balance of these factors which is modulated in a favorable direction. And that is our aim when we think of therapies in COVID-19 infection. So modulation. And today, of course, as we have slated the topic of some of the nutrients modulating immunity. So I think the reason why we are looking at is that in this particular disease, what we are looking for is immune modulation, so that we can direct this immune mechanism into a favorable direction, which will be conducive to recovery of the patient, especially the lung, gastrointestinal tract, and to some extent brain. These are the three targets of this immune inflammation in a COVID patient, you see.
So when there is an inflammation, and that inflammation also involves the GI tract. Some people even debate that GI tract may be involved up to 50% of the cases because even the virus can be seen in the stool. Now, there is peculiarity about this virus. It spares many organs. It spares large intestine. It spares larynx. It spares mediastinal lymphadenopathy. It spares all the joints. It doesn't cause arthritis. Selectively, it involves from cricopharyngeal muscle to esophagus to gastroesophageal reflex, sphincter to stomach to small intestine up to ileocecal junction. So selectively, it involves the smaller GI tract and where we get absorption of protein. So therefore, when there is no absorption of protein, there is hypoproteinemia. It absorption of amino acid doesn't take place. Folic acid is absorbed there. B12 is absorbed there in stomach and in the large intestine. Zinc is absorbed from there. Calcium is absorbed from there. Iron is absorbed from there. So therefore, this virus is going to lead to nutritional deficiencies of all the nutrients which are absorbed by small intestine. Dr. Yes, Dr. Himraj.
Yeah, I think I would like to also say that our, we think that once you partake of the mixed diet, you don't have nutritional deficiencies. But now it has been shown that almost 50% of people, when seen carefully, have micronutrient deficiency. And also remember that currently, you see the food that we eat, vegetables and fruits are the main foods which provide micronutrients, which we are talking about today. And it has been shown that over the decade per decade, the amount of micronutrients in these fruits and vegetables are dropping. So there are very good studies showing that. And last of all, I must tell you, because we are talking to medical community, that your patients being treated for comorbidity, for example, diuretics, you see, they can produce a B1 deficiency in critically ill cardiac patients nowadays. Even B1 deficiency treated, glucose with B1 infusion is given. You see, and of course, hydrochlorothiazide long term can produce zinc deficiency. So I think these are the backdrop on which we are thinking about the deficiency. And remember that vegetable and fruits have become less easily available during COVID period. And the variety of them have disappeared. Initially, supply chain was totally interrupted. Now it is already restored to some extent. So we are able to get vegetables and fruits. So these are the factors which are producing bad micronutrient deficiency in our people. And when they get COVID infection, these lead to a very severe immune response. See, and that really is the what really drives them to the ventilator, or drives them to anoxia, hypoxia, anoxia, ventilation, and mortality. So I think we have to look at some of these and of course focus on two today, that as we slated, omega-3 fatty acid and zinc. But I must tell you that there are multiple deficiencies are possible. And all the micronutrients are involved very heavily in many ways in our body's immune processes. Like you see, for example, A, C, E, and zinc are involved in maintaining the mucosal barrier. So there is a mucosal barrier in the bronchi also. So those barriers are broken. Cellular responses by vitamin A, B6, B12, vitamin C, D, E, folate, iron, zinc, you see, and copper and selenium. So, they are involved in so many processes. When you see our biochemistry, all the processes are catalyzed by the micronutrients. So sometimes we lose sight of these. We only understand macronutrients well, but we don't pay as much attention to these. And the antibody responses by all these vitamins and minerals, except iron and vitamin C, are not involved in antibody formation, but all vitamins and minerals are involved. So antibody response will be reduced or will be altered. So I think it's very important to maintain a balance of micronutrients in a situation where there is a immune inflammation.
So, as a metabolic syndrome, your micronutrient deficiencies may be there. Super added to that is inflammation of small intestine, where the absorption is impaired. And super added to that is that you are not going to sun, you are not going out, so though you're not even taking vitamin D. And you may not be able to take lots of sprouted fruit, which gives you lots of micronutrients. You end up into micronutrient deficiency. Over that, when you develop COVID-19, the disease may not be you may not be able to control the disease. Coming back to an ideal nutrition, we must give them a protein, because there is a protein losing enteropathy in COVID-19, and therefore protein must have amino acids. And when it comes to therefore a role of amino acid comes. Number two comes is you need a diet which is a supplement or a diet which is anti-inflammatory. And we know N3, and we throw N3 N6 ratio in any fat, and we know that omega-3 are protective and omega-6 are inflammatory in origin, and that's the reason we talked about that N3 should be predominant. And when we want to protect any inflammatory condition in a vessel wall, role of omega-3 fatty acids automatically come. And we need a drug which works at the level of cytokine and as well as at the level of bradykinin, because bradykinin storm and cytokine storm are responsible for this disease. In bradykinin, the simple answer is a herbal. This green tea is a bradykinin inhibitor. But when it comes to giving a person a cytokine action at a cytokine, specifically when the virus enters and there is a RNA polymerase, and there we need the role of a zinc. Ciliary, nasociliary movements, we need the role of the zinc. And then comes is folic acid. Large number of patients we are seeing, they are developing both. They are developing high MCV. They are developing a macrocytic anemia, which is being shown because of both folic acid deficiency and B12 deficiencies. So therefore, we need to replace during COVID era, we need to replace omega-3 fatty acid. We need to replace them with folic acid. We need to replace them and give them zinc. Need to give them calcium. We need to give them vitamin D, and we need to give them vitamin C. Dr. Himraj.
Yes, I think these are important, and we will start looking at, for example, omega-3 fatty acids. We have been discussing this in relationship to hyperlipidemias also, and they have been used for a long time now. The omega-3 fatty acids, we call them because the first unsaturated bond appears on carbon 3, so these are omega-3. Now try to examine omega-3 versus omega-6, and there is a competition between these. Omega-3 is highly beneficial. Omega-6 can be even injurious. You see, in many processes in the body. For example, eicosanoids like leukotrienes and all are produced by the modification of omega-6 fatty acids. When omega-3 is present, this eicosanoid production is reduced. So this is one area where it helps us. It reduces the production of eicosanoids, which result into harmful substances, which we are talking about presently, which are injurious mostly to the vessel walls in a big way, and of course mucosa surfaces in many places. You see, so I think remember that these are essential fatty acids. Omega-3 are essential fatty acids. See, they are derived in certain oils contain omega-3 fatty acids, of which most notable is our mustard oil and canola, which is genetically modified mustard seed from which are discovered in Canada first, where there is a reasonable amount of omega-3, and a few other oils and few nuts like walnuts contain omega-3 fatty acids. So in natural form, we get it to some extent. But in this situation, you may need therapeutic doses. Remember that some of these compounds can be therapeutic. We talk of drugs in doses of about a gram sometimes. And remember that 500 milligram to a gram of this can change a lot of biochemistry in the body. So they are almost sometimes as potent as drugs. We don't realize that nutrients may have a role which is more potent than that of the drugs that we keep talking about. And omega fatty acids are like that. For example, 500 milligram to 1000 milligram is the intake required. And sometimes the deficiency you replace by a few grams a day, it can work wonders. What it does is, you see, it is what it does is it is one of the what called pro-resolution mediator. This is a very interesting term used in nutrition. Pro-resolution mediators. These are the substances which help in resolving the inflammatory process. So they are almost like coming and sweeping away all that all that violent responses that have occurred because of immune inflammation. So they help you in resolving some of the damages or some of the materials present in the alveoli, you see, which was inflammatory or which was as a result of immune inflammation, and they are called therefore pro-resolution mediator. This is a word used for many other micronutrients, and I think omega-3 fatty acids are one of them. See, so what it has been shown that use of these in the COVID infection has shown in some study that it reduces the days of hospital stay. It reduces, you see, the number of people going to the ventilatory support, and number of people go into multiple organ failure, which is part of bad COVID problem and at last mortality. So it has produced results to some extent, you see. So it may be of good help in people suffering from COVID infection. And of course, it will cause resolution. You see, there is very good review, you see, which showed that, you see, this is a pro-inflammatory, the pro-resolution of the COVID infection. It is quite effective. So I think we have always used them, consider them in people with lipid problems, which is of course causes low grade inflammation. So we have treated triglycerides with these drugs as well. It is docosa pantenoic acid and hexosa pantenoic acid. But omega-3 form of these are the ones which are beneficial. Not the omega-6. Many oils that
So,
we eat contain a lot of omega-6. Omega-3 is only present in few oils. So this is very important to know.
so omega-3 fatty acids, we have finalized, yes, that when there is a protein losing enteropathy, and omega-3 fatty acid as a micronutrient is good for prevention and treatment, not only of corona, but also of atherosclerotic heart disease and all metabolic disorders. Now time comes for talking about something about zinc and something about the folic acid, but after a short break. You are watching Med Talks with Dr. K.K. Agarwal, 7 p.m. show every day, and we have our guest, Dr. Professor Hemraj B. Chandalia, an expert in nutrition, diabetes, and metabolism. And before the break, we were talking about the role of amino acids. Let's now concentrate for 5 minutes on the role of folic acid. In India, we know the type of traditional cooking. We have changed from Ayurvedic cooking to the modern medicine cooking. We are no more using a low heat production. We are doing cooker, fast cooking, and everything. And when we do, being a water soluble, the water folic acid is lost. So being an Indian, we are folic acid deficient as on today. But classical Ayurvedic cooking had been कि हल्की आंच में खाने को बनाओ, but that's no more done. And that's the reason we are folic acid deficient. How to do that? How to take care of that, Dr. Hebraj?
Yeah, I think the vegetable and fruits, in unprocessed form or not cooked, or at very high temperatures, are good sources of folic acid. And folic acid is very important. All of us have realized the importance of folic acid in pregnancy, for example. And it is important in the organogenesis of the fetus in the first 3 months. And the deficiency now, of course, we also realize very monumental work from Pune by Dr. Yajnik that it is also concomitant B12 deficiency there, which results into a lot of problems in the fetus. So folic acid, we realize the importance of folic acid in the metabolism very, very well in some of the clinical situations. See, and for example, now in this COVID period, the pregnant women who always are on folic acid, so they some or other we have seen that folate deficiency is 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 less common, in these people. You see, and of course the COVID infection is somewhat mild in this situation. Of course, pregnancy is a situation where the immune responses are very different. Overall, it is a suppressed immune response state. So surprisingly, all of you have seen pregnant women, with COVID infection delivering without any problem. And fortunately, many of the babies also have been found not to be infected. All of you might have seen these examples now with COVID raging all over the country. You see, and some of this benefit may be one, the pregnancy being a a sort of suppressed immunity state, and secondly, you see, folic acid supplement universal in pregnancy could have been one of the helping factors. You see, what folic acid does is it controls what activity of an enzyme called furin, and the furin enzyme is required. You see, furin protease and another protease 3CL is required for the replication of SARS-CoV virus has been shown. This may also apply to COVID virus because it is very close in the family relationship to SARS-CoV virus. So for the replication of this virus, you see this protein is a protease is required, furin protease, and when you give folic acid, the furin protease activity comes down, and therefore replication of virus is inhibited. So I think this is one way it works. You see, even the lymphocytes, you see, even the in the blastogenic response of T lymphocytes. See, when the T lymphocytes have to exert their immune effect, you see, then they turn into blastogenic phase. And that response also, you see, in folate deficiency, that response is impaired. And even the antibody response with folate deficiency is impaired. So I think it has a lot to do with immune processes, and therefore replacement with folic acid is very important. And what has happened during the COVID period, as I mentioned earlier, because the vegetable and fruit intake has come drastically down. And I must also tell you that in general, in Asian countries and in India, it has been very well shown that the vegetable and fruit intake is low. Fruit intake is still reasonable, but vegetable intake is much less. This is very well shown by people working in the nutrition area. So folic acid deficiency may be existing there, and I think is worth treating this.
One nutrient which is the talk of the town, if you talk about, you cannot think of Agra without Taj Mahal. You cannot think of dengue without platelet count. You cannot think of COVID without C-reactive protein and zinc. In terms of diagnosis, C-reactive protein, and when it comes to nutrition, zinc, zinc, and zinc. Zinc, zinc everywhere. Nobody had talked about zinc so much as we have learned during this COVID-19. What is the role of zinc in COVID-19? Dr.
Yeah,
Hivraj.
yeah. Zinc also has a lot to do with immune processes. For example, you see the regulation and development of many cells involved in the innate immunity and adaptive immunity. Innate immunity is basic immunity we have, which is immediate responses, and the adaptive immunity that we have, where we recruit, you see, the lymphocytes and all, and then mount an adaptive immune response. So both these cellular processes or their development, you see, involves the presence of zinc. So zinc is very much involved in this. You see, for example, you see, it has been shown that if you see the zinc inhibits the an enzyme called ACE2. Now we have been talking about ACE2, angiotensin converting enzyme 2, which is involved maybe in the entry of the coronavirus in the cells. So this zinc inhibits this ACE2 enzyme. See, this is how initially the controversies came whether ACE inhibitor should be used, but the sites are slightly different, and we know that person who is very well controlled with ACE inhibitor, you see, or ARB with hypertension, you should not upset that balance. This is what I think is the sum of the opinion. But this ACE2 receptor is a different one. And there I think, this is very important. The zinc, you see, inhibits or it reduces the expression of ACE2 receptor. You see, and of course it has been shown that it inhibits the SARS virus, you see, polymerase. SARS virus. So replication of SARS virus, again, zinc has been shown to lower. And of course, the zinc increases, some very beneficial uh, uh, molecules like increase in interferon alpha. It increases the mucociliary activity. It is responsible for mucociliary activity. Like I told you initially, the barriers in our body which protects us from invading agents. So these two are very important, and some harmful, you see, cytokines and all that, like nuclear factor kappa, you see, B signaling is involved, and remember that bacterial infection zinc is very important. So bacterial co-infection in COVID is also one way we lose some patients, you see. So I think the zinc will definitely modulate that co-infection with bacteria, and will give us favorable outcome. So I think some of these actions have been shown, you see, and of course the zinc will reduce the viruses zero genome transcription. The transcription of viruses blocked by zinc. You see, the attachment of virus to the cell surface before entry also it change. The zinc decoats the virus. The virus is coated, and that's why it survives a long time on different surfaces. The coating is removed. So in the body also, coating of the virus is removed. Then our immune processes are then more efficiently take up the virus to limiting the virus infection. So I think some of these actions which have been shown in vitro in animal experiments, you see, they all show that zinc is very important in the processes. And in this situation, I think, and as I said, you see, normally eating person it may not happen, but these diabetics, hypertensive, they are given restricted diets also. That is one factor. And restricted diet, and I mentioned diuretics depleting zinc, you see, and low priority depleting magnesium and potassium, and all these things are very important. So these are the people really succumbing to the serious outcomes of COVID infection, and they are already being treated by the drug, so they are very susceptible to these problems. Remember, we use zinc therapy in people with HIV and people with hepatitis C who are undergoing treatment, antiviral treatment. There also zinc is a recommended supplement. You see, in all the people who treat this, they give the zinc as a supplement because it again has favorable outcomes. It has been shown. So I think it's a very, very important micronutrient. You see, in the immune processes, and in modulating immunity during COVID, it will be beneficial.
सो इस कोविड ने हमें न्यूट्रिशन के बारे में बहुत कुछ सिखाया है. आयुर्वेद भी आगे आया है कि गिलोय खाओ, आप अश्वगंधा खाओ. इधर से मॉडर्न मेडिसिन भी आगे आई है, न्यूट्रिशनल सप्लीमेंट्स, वेदर इट इज विटामिन डी, सी, एंड नाउ वी आर टॉकिंग अबाउट ओमेगा 3, फॉलिक एसिड एंड जिंक. सब लोग इसके बारे में बातचीत कर रहे हैं, न्यूट्रिशन के बारे में, वेदर इट इज इननेट इम्यूनिटी, एडेप्टिव इम्यूनिटी. And people have gone to the extent of talking about the role of thymus, the thymic hormone, and they are talking about replacing thymosin alpha hormone in adulthood as an adjunct to build up immunity and an adjunct for vitamins, because now we are talking about adjunct for vaccination, adjunct for immunity, supplements as an adjunct for immunity, and whatnot. Before I thank my speaker, let me take quickly a few questions. How to get zinc from natural food? This is Lena. Anything which is sprouted is good. And then somebody is talking about natural sources of zinc apart from diet. He's talking about dry fruits. Yes, that has been already spoken about that. Then there are people are appreciating the program. Some people are directly talking about फीवर 100 से कम है तो कोविड में हो सकता है, चिंता करने की जरूरत नहीं है. And we have somebody is talking about flax seeds. Till I'm seeing, can you talk about something about flax seed, Dr. Himraj?
Yeah, flaxseed is rich in omega-3 fatty acids. It's a source of omega-3 fatty acids. So many people use flaxseed oil they use, or they roast flaxseed and they use it as a mukhwas, what we call. You see a good amount of that. So I think it is a provider of omega-3 fatty acids. Flaxseed is.
एक आदमी कह रहा है कि कैल्शियम को फॉलिक एसिड के साथ खा सकते हैं क्या, और कैल्शियम कब खानी चाहिए, सुबह या शाम?
Yeah, Calcium is often eaten after dinner. It's a reasonable time. Remember that calcium tablets can upset stomach, so it's better after meal. Um, you see, some nutrients should not be combined. For example, they're simple like iron and even the green tea, herbal tea, or copper and zinc cannot be combined. So these are some of the caveats. There are some problems, incompatibility of some of them in the medications, which are taken care of by the people who formulate. They know the what cannot go together. So I
So
think that is done safely by them.
Ashutosh is having some lateral thinking. Can phlebotomy be an option in treating the inflammatory phase of COVID? I have not heard about this. He's saying phlebotomy करके देखो.
Which one?
Phlebotomy. Is there any role of phlebotomy? Blood निकाल के फेंक दो
Oh,
COVID-19 में.
phlebotomy, yeah. Oh, phlebotomy. After somebody gets COVID infection, take out the blood and do plasma therapy. Of course.
So that's all. There are a large number of questions, but I have fixed up only a few of them. But yes, soya protein, soya is estrogen, phytoestrogen, and soya also is known to be good for IL-6. So when it comes to natural, haldi as a TNF blocker, soya is IL-6, and green tea is working at the level of bradykinin. So there are certain types of foods, but whatever you do, as on today, you need supplements. You have no choice because you cannot get heavy doses of supplement which you need. At this particular season, you need a combination of both Ayurvedic as well as modern medicine supplements. Both are complementary to each other, whether it is giloy, whether it is ashwagandha, whether it is haldi or ginger as promoted by the Ayush department, and whether it is vitamin, folic acid, zinc, omega-3 fatty acids, and obviously the role of vitamin C, which comes from amla, and the role of vitamin D stays there. That's all for today. Let me thank Professor Hemraj to be here with us, and it was
Thank you.
wonderful meeting you and wonderful
Thank you,
interacting with
Dr.
you.
Agarwal. It was nice to have been with you on this platform. Yeah.
All my viewers, I'll be back tomorrow with another show, 7 p.m. Stay tuned.